Here's some numbers for you. 1 in 6 couples in Alberta struggles with infertility. For Infertility Awareness Week, our health specialist Leah Sarich is here now with what men need to know about their reasons for infertility, why funding fertility treatments may be the way of the future, and we know it is somewhere other places in the country.
Exactly, and we'll get to that in just a minute. But I'm so passionate about this issue because it affects so many of us, and we don't like to talk about it.
Right.
And this is something we need to talk about, so we're talking about it again. Infertility is defined as 1 year of unprotected sex without a pregnancy. So that's how we define it. And it's still commonly believed that if there's no baby, it's the woman's fault, when in fact that is not the case at all. In at least 40% of cases, it is a problem on the male side. 40% of cases, it's a problem on the female side. 20% of cases, it's either both or it's unexplained.
That kind of blows my mind that there's this preconceived notion that it's just...
That's right. Yeah, no, it's pretty much right down the middle. So we know that a woman's fertility starts to decline in their early 30s. Now, for men, this does occur much later, of course, as we all know. But that said, the quality of men's sperm goes down after the age of 40. So I spoke with Dr. Calvin Green from the Regional Fertility Program. And for example, with their sperm donor program, they will not accept sperm from men over the age of 40.
Whoa.
Interesting. So men should be aware of their potential for fertility problems as well.
There can be a number of difficulties with the semen sample. One, there might not be any sperm, and obviously that's a big problem. There may not be very many sperm. In other words, there's a low production. Sometimes the sperm that are produced don't move very well, and movement of the sperm is actually very important because they have to move from the vagina right up into the fallopian tubes to cause fertilization. And sometimes the way the sperm are formed, they're morphologically or normal, and what I mean by that is the shape of the head is abnormal, and that can interfere with the ability of the sperm to penetrate the egg.
So there you go. Lots of things can go wrong with the sperm indeed. Now also every year we talk with Dr. Green about the logic of having fertility treatments funded by the province.
Right.
So Dr. Green says, you know, they're very good at fertility treatments now. They're very successful with IVF. For example, have a look at these guys. That's Lucas and Azriel. They're 4 now. They're IVF babies. So their mom, Shelby, if you can imagine, was diagnosed with infertility at the age of only 25.
Oh, that can
so
be
that's something
devastating.
else to keep in mind. Is it not just women who've delayed childbearing until they're 40. You know, this can happen at any time. It's a medical problem. So she was diagnosed at the age of 25. Now these twins, they were born in 2009 when the rate of twins with IVF was 30%. Well, now it's already down to 16%. So they've pretty much cut that rate in half and maintaining that successful pregnancy rate. So that's what we want to do. So what doctors can do now is transfer fewer embryos back into the woman, resulting in fewer multiple births, fewer high-risk pregnancies and deliveries, fewer long-term costs down the road if the babies were to require care for years and years to come, which often is the case when you have multiple births.
Sure.
So Shelby says, you know, it only makes sense that the province start funding fertility treatments.
Anybody who pays a mortgage, has a car payment, student loans, to come up with a lump sum of money in order to have a child, you know, it's a lot. So I want people to think about their own children, and if they were to face infertility, wouldn't they want them to have the help available to them? I mean, we talk about the kids all the time, about their story, and yeah, they know that they were embryos, and we're also thankful to the doctors, and every day that I look at them, I just feel like overwhelmed and thankful.
Of course she does. Isn't that sweet? So in fact, Dr. Green is in talks with the province right now about funding fertility treatments. So we have a little bit of motion on the issue since last year, which is great.
Okay, so I mentioned this earlier.
Yes.
Elsewhere in Canada, it's already moved further.
That's right. So in Quebec, they're already fund 3 cycles of IVF.
Right.
In Manitoba, they have tax credits for IVF. And Ontario now will start funding IVF in 2015.
Okay, Alberta, time to get on board.
Time to get on board.
More information on your blog.
Yes, we'll follow what happens here for you.
Health specialist Leah Sarich, thank you very much for
You're
that.
very welcome.
BreakfastTelevision.ca, the way to find her, and that's fine.